Welcome. We are so delighted that you are here. Thank you for taking the time out of your day to be with us, to celebrate global nursing together. Wherever you're joining us from, whether it's morning, afternoon, evening, or the middle of the night, you are very welcome. This year's International Nurses Day theme, Our Nurses, Our Future, Empowered Nurses Save Lives, emphasises nursing's role in addressing health inequalities and shaping healthier futures for people, place, and planet. On International Nurses Day, we join the global nursing community in celebrating the diversity of nurses and nursing with expertise and compassion. Nurses lead care across communities and health systems around the world. This is an important moment for the Burdett Trust for Nursing as we launch our new way forward. Over the next 5 years, we will create partnerships that bring active hope and positive change. We'll build on all that we've learned since our foundation in 2002. We're hoping to convene brave conversations which bring together nurse leaders at every level, as well as policymakers and funders, to enable innovation in the present and to imagine a radically different future. A future where relational care is central. Digital innovation is embraced. Creativity is unleashed. Prevention is prioritised. Sustainable, equitable health for all is realised. This vision will shape our strategic pillars of grant making and partnerships, supported by our investments and governance. On International Nurses Day, we want to celebrate the dedication, courage, and leadership of nurses everywhere. At the Burdett Trust for Nursing, we support nurse-led models of health and social care that enable nurses and nursing to flourish. And we're especially proud to have been the funders of the Nursing Now and the Nursing Now Challenge since 2017. We have also funded both of the State of the World's Nursing reports, which shows the commitment that a small UK-based trust has to the future of global nursing. It's my huge privilege to hand over to Professor Gemma Stacey, the Director of Nursing Now Challenge, who is an extraordinary, visionary nurse leader. As well as being compassionate and insightful, she is also one of the most productive and effective leaders I know. And she's going to introduce our time together. Welcome, Gemma.
Thank you so much, Claire, for such a warm welcome and a real warm welcome from me to all of you that have joined us today to celebrate with us International Nurses Day. I have the privilege of occupying the role of Programme Director for Nursing Now Challenge, and I wanted to take a few moments at the start of the day to share those of you that are either on the peripheries of our community, joining us for the first time, partners and supporters of Nursing Now Challenge, to help you understand a bit more about the breadth, the depth and the power of the network that we represent. So the Nursing Now Challenge, when we move on to the next slide, will show you that we are a truly global network. We represent a community that spans over 150 countries, and that enables us to reach over 250,000 students and early career nurses from across the world. People join us through their organisations or as individuals, and they join us in our mission and our vision to create a global community of students and early career nurses and midwives who are enabled to lead transformational change in their context, to advance health equality and strengthen their health system worldwide. We achieve this by building their capacity through leadership development, through deep engagement, collective learning and action, helping each other to develop our resilience and our emotional well-being, and supporting each other to create opportunities for advocacy and influence on a global level, but also within our own contexts and local perspectives. We do this through living our core values. We believe that every student and early career nurse and midwife has the opportunity and capability to lead and influence. But they do this through their collective action, and they take the global nursing and midwifery policy and evidence priorities and apply it within their context. They do this from an evidence-informed perspective, and we represent a community that pays attention to and consciously leans into creating inclusive spaces for learning together. And it's a continuous learning process. We question each other, we challenge each other, and we push each other to lean into uncomfortable spaces to create the opportunities for transformational change. There are two statements that you will hear the Nursing Now Challenge repeat continuously, and one of those is the title for our session today, and that is "The future is now." And this is based on the premise that we want to challenge the idea that our students and our early career nurses are the future. We actually want to show that our students and our early career nurses are our now, that we need to be able to create opportunity to hear their experiences, to really harness their enthusiasm and passion for their profession, but really importantly, to listen to what they need in order to thrive within this profession. Their fresh perspectives give us a viewpoint that we don't have access to once we become more established within the profession. And it's really important that we create opportunity for those voices to be heard and to have influence. But it's also really important that we don't place the burden of responsibility for this transformational change on our early career workforce. They occupy positions without formal authority, so it's really important that we create opportunity for them to work with our structures and our processes to be heard, but similarly not to undermine the value of combining that fresh perspective with the wisdom of the experience of our established workforce. And that's where we talk about the togetherness, the collective power of nursing and midwifery when we bring these different perspectives and versions of expertise together. And that's really what we're hoping to do today through this particular event and throughout the whole programme of Nursing Now Challenge. And this is possible because we have really committed and supportive partners. This includes the World Health Organization and the International Council of Nurses, who have prioritised their time on International Nurses Day to spend it with us and contribute to our programme today. We also have partners and supporters who are here to engage with you through the exhibitions, and so that you're able to understand how their organisation is contributing to a future where we lead together. So thank you to the Foundation of Nursing Studies, the Royal College of Nursing Institute for Nursing Excellence, St Christopher's Global Palliative Care Network, JA Mental Health, the Global Health Partnerships, Nursing Times, Health Action Training, the Centre for Sustainable Health, the Daisy Foundation, and the Alliance of International Nurses and Midwives Diaspora UK, who are joining us here today as partners. I'm going to hand over now to Hannah Finch, who is our Director of External Relations, and she'll tell us more about how today has been put together to enable that sense of togetherness and to really place a focus on the future is now.
Thank you so much, Gemma. Hi, everybody. Happy International Nurses Day. It's such a joy to be here with you all today and to wish you a very, very warm welcome to today's event and a happy International Nurses Day. It's fantastic to see so many of you joining us from our community and beyond. And we are just so thrilled that you have decided to share, even if it's part of your day with us. We know that it's an incredibly special, but always very hectic day. So thank you so much for being here. Today is all about you. We celebrate you and your wonderful, wonderful profession. And we wanted to take this opportunity to spotlight and really celebrate the power of collaboration and connection that we have built and continue to build through the Nursing Now Challenge global community. People often say to us, what is the Nursing Now Challenge? And I really, truly believe that the Nursing Now Challenge is a collection, a group of people who are deeply united by a shared vision and purpose, who come together so willingly, generously to share their experiences, their perspectives and their insights. And that is really what today is all about and how we have put together today's agenda. We really wanted to emphasize the importance of collaboration and connection, be that with our members, our global stakeholders and partners. So you will see that throughout the course of the day, there are various sessions that will hopefully facilitate and enable you to have meaningful opportunities for connection. We have a couple of networking sessions. One is more informal and the other you'll be matched with participants who are at different stages in their career but have shared interests and who can hopefully help you at whatever stage you may be at in your career. If you head to our booths, you will see all those many wonderful event partners that Gemma just mentioned, who are here to share their work and everything that they do to support the nursing profession. In our lounge, you can connect with members of the Challenges Committee, our regional hub leads, who can give you a little bit of information or a lot of information about the incredible work that they do around the world, leading change and shaping the future of nursing. So thank you all so very much for being here. We really hope that you enjoyed today and that you really do, make the most of those opportunities to connect and continue to build the wonderful relationships that the Nursing Now Challenge is all about. Thank you all and have a wonderful day.
Thank you so much, Hannah, for your warm wishes and welcome, and to really highlight the opportunity that the platform we have available to us gives to those of you that have chosen to join today. It really is a session that is around dialogue, so learning together and entering into conversation with each other. And we really hope you'll take the opportunity to do that through the different mechanisms Hannah explained. Now, it's my real pleasure to formally open today's sessions. And our first session is to be hosted by Dr. Carey McCarthy, who is Technical Officer in the Health Workforce Development at the World Health Organization, and very importantly, the co-author of the State of the World's Nursing Report. Now, this report has a really warm place in our hearts here at Nursing Now Challenge, because the challenge was so instrumental in not only contributing to the development of the recommendations from the report, but also profiling and enabling its launch across the world this time last year. So we're absolutely thrilled that Carey is able to join us today to talk to us more about how the State of the World's Nursing Report has progressed over the year, the way in which countries have used the data to define their priorities and progress that has been made against those recommendations. And we're also going to be joined in person and via video by some really senior nursing leaders from across the world to hear more about how the report has influenced within their countries and context. So without further ado, I'll hand you over to Carey, and thank you again for joining us.
Thank you, Gemma. Hi, everyone. It's wonderful to be with you. Happy International Nurses Day. As Gemma said, I am the technical focal point at the World Health Organization, the headquarters in Geneva, Switzerland. I was the lead author on the State of the World's Nursing Report. And as Gemma also said, it was a collective global effort from the Global Steering Committee that had a representation from all around the world, all the 6 WHO regions. And we had a big launch, and we were so keen to hear from the different regions that had Nursing Now Challenge groups who were launching the report and having dialogue and talking about the implications of the report and the findings and the importance for their regions and what they were going to do to utilize and leverage that data in their own country context. So it's been something we have been so excited to be a part of the global dialogue on. And in this discussion today, I'm going to just chat a little bit about what those findings were, and then why they are important, and what are the takeaways from those findings, and what are the aspects that early career nurses, student nurses can take forward and bring to the fore in their own discussions in whatever contexts those are, to talk about how you advance nursing and midwifery, the workforce, the issues, and even the leadership needs and programs in your own countries. So I'll go over a couple of the key findings, but talk a little bit more about why they matter and the so what and the what next of those findings. And then I want to give a few examples, or I'll just highlight a few examples of what countries are doing with that report, because as Gemma said, it's been a year and there's been a lot of activity. Something I'll share with is how many of the countries and regions and even sub-regions have taken those findings from the State of the World's Nursing Report and utilized them for advocating and pushing for policy change and development and investments in their country. So why do we do the State of the World's Nursing Report? It is for exactly the kinds of activities that are going to be highlighted in this session today, that the government chief nurses are going to explain about what they've done with the State of the World's Nursing Report. It is to provide everyone around the world with the updated evidence that we can use for action and for policy dialogue and planning how and where you situate your nurses, because nurses are a really strategic resource, and they can do a lot in a health system, especially if they have updated regulations on their scope of practice and they have a strong pre-service education and training. They can do a lot. So health system planning around nurses can be a really effective way to expand coverage. So and enhance access and quality, and even help address issues like cost and inefficient use of resources. Nurses can do a lot. So we need to make sure that countries have the data on their nursing workforce. So we use the State of the World's Nursing Report, and we use these globally standardized indicators that every country reports to WHO, and they can use that data to help plan where and how nurses are in the health system and where they are across the country. And I'm going to go back one slide so that they can best make progress in their own health systems. We also do that because not just for this evidence and planning, but we also believe that having that data, I should say, to have really robust representative data, it does take engagement from across the country. It does take engagement from educators and regulators and the associations and the unions and definitely government, and sometimes various aspects, various bureaus and various departments in the government to get that full picture together, and lots of partners. But having that data is then also that the basis for the policy dialogue, getting people together. And you're going to hear examples of that policy dialogue and from Nursing Now Challenge representatives who have been a part of that dialogue. And that dialogue is the foundation for the evidence-informed decision-making. That decision-making is where and how to invest in nursing and midwifery. And that investment is what then catalyzes change. Investment can also be the policy change that makes the path for progress, not only on the health-related SDGs, well, definitely on SDG 3, which is good health and well-being, but the health-related SDGs that are especially influenced by investments in nursing and midwifery. like education and gender equality and inclusive growth and decent work. So those are the reasons that we do it. And we see this at a global level, and we see it at a sub-regional level and a country level, which you will hear about today. Okay, next slide, please. And I love to give this example on the next slide, which is how we saw this play out in 2020. We had, 2019, when the executive board of the World Health Assembly, so those key ministers of health that advise WHO and inform what the World Health Assembly discusses, they decided to have the Year of the Nurse and the Midwife. So that was the broadest engagement that we could ever ask for. That was really driven by that partnership with Nursing Now and WHO and ICN. And it was also had leadership from the government chief nurse of Jamaica, who brought it to the executive board to consider that Year of the Nurse and the Midwife, which was fantastic engagement and really exciting to have Nursing Now challenge on that global stage and to partner with them. And with those really broad partnerships, we were able to do the very first State of the World's Nursing Report and the State of the World's Midwifery, which hadn't been done in almost 10 years. So we had this exciting engagement. We had the data finally, and that was the reason we could have, for the very first time, this dialogue at the World Health Assembly in 2020, where we talked about the issues with nurses. And we have a photo there of Her Royal Highness Princess Moon Al Hussein of Jordan, who is the WHO ambassador for nursing and midwifery. And she spoke about this data, and she spoke about the challenges of nurses and midwives. And this was during the pandemic. So those are really at the forefront of people's minds. And that was the very first time that decision by the World Health Assembly to request WHO to develop and adopt the global strategic directions for nursing and midwifery. So based on this data, they said we need this global strategy. And so we developed that through a very involved consensus model. And then it was adopted by the World Health Assembly, again, for the very first time, with a resounding resolution on how all countries should advance the global strategic directions for nursing and midwifery for the purposes of strengthening the nursing workforce and the midwifery workforce, so we can make progress towards these SDGs. So that was a really big deal, and that is part of the mandate that government chief nurses and midwives and partners have been able to capitalize on, is this global mandate for these strategic directions. So I'm going to spend just a minute on the next slide about the global strategic directions, because this is what you'll also hear some of the government chief nursing midwifery officers talk about. That's because the global strategic directions were endorsed, and they are essentially 12 policy priorities. There are policies in education, in jobs, in leadership, and in service delivery. And in education, it's about making sure you have the right levels of nurses, like what levels of programs do you have, and what levels of graduates what levels of nurses are you graduating? And then to have enough of those graduates to make sure their education is of the right quality and relevance. So that can include support for faculty and working with digital health tools and AI. And then also making sure that those faculty are supported, which is you have enough faculty and they're supported. In the area of jobs, it's making sure you're doing that planning to understand where and how you're utilizing nurses and midwives to the full extent of their scope of practice and education and training. And it's making sure you have enough nurses. So we call that the demand for nurses, and the jobs for nurses are there. And then managing issues like international migration, which we'll talk about in a little bit, has been a really big and growing issue. And then also to make sure you have and can recruit and retain nurses and midwives in the places that they are needed most. In the area of leadership, there's 2 policy priorities about making sure you have that government chief nursing midwifery officer position, and that it has the authority and the resources that is needed for effective leadership. And then the other one is about developing the next generation of leaders. So those student nurses, those early career new nurses who need investment in their potential as well. And that can be national programs, or which we advocate for in the strategic directions, or other opportunities like Nursing Now Challenge that can develop those leadership skills and the networks, because we know that we need those future leaders now. In service delivery, it's really about the regulation, the professional regulation of nurses themselves, to make sure there's initial competency and continuing competency. And then the last one in service delivery is the working environment. So that is making sure that nurses and midwives are supported and protected. They have the resources that they need, which can be different depending on the populations that are served, but also decent work environment and all the aspects that go along with that protection, supporting, and safeguarding in the workplace. Next slide. So that was 2021 when these are adopted. And as part of WHO's monitoring, we check on how countries are advancing these policy priorities, which are the ones that they're doing well in, which ones have been more difficult, and what support they need from WHO to be able to strengthen their nursing midwifery workforces in line with the strategic directions. So that's the bar graph on the left, which shows how countries are implementing these strategic directions. And you can see that there's a lot of activity in each one of them. The one that is the lowest bar that you might be able to see there is the one on implementing the WHO Global Code of Practice on international recruitment of health personnel. So that's the international mobility and migration of nurses. And that's the one that government chief nursing midwifery officers has reported the least activity. And that could be for a number of different reasons that we can talk about later. But we know that is an area that we need to support and engage with. So as I mentioned, that last global dialogue and discussion that advanced the strategic directions based on the evidence in the state of the world's nursing and the state of the world's midwifery was in 2020. So we had a pandemic, a global pandemic in that time. And we also had a lot of landscape changes in the global development, the global health context. So we know we needed another state of the world's nursing report for those reasons of understanding the changed picture of the global nursing workforce, and also to do that planning, that service delivery model considerations, and thinking about forecasting to 2030, knowing that we only had 5 years left in the agenda for sustainable development. And we need to make sure that we had that information at a global level and a country level. So that's why we decided to do the State of the World's Nursing 2025. We were really lucky to be able to have partner of the Burdett Trust for Nursing, which helps support the development of the State of the World's Nursing Report and the dissemination that you're going to hear about today. So they were a really key partner along with ICN that helped bring the State of the World's Nursing 2025 to the world at this really critical juncture. Next slide. So in the State of the World's Nursing Report, you can go to the next slide. I just give you a little overview of what is in it, because there are a lot of different pieces. Yes, we have this one main global report, and it has the data and the analyses at the global level and the regional level. And they're presented along with, in terms of those 4 areas of the strategic direction. So they're presented in terms of jobs, education, leadership, and service delivery. We also have areas that don't have globally standardized indicators, but they're key areas for nursing. So we did an evidence summary, kind of state of the science in each of these different areas and more that are in those summary areas, because we need to get into a deeper discussion in the State of the World's Nursing Report on some of these areas. And then while we show the data at a regional level, as well as at a regional level, we took some time to put the regional data analyses together, kind of consolidated in what we call the regional pages for each of the 6 regions of the WHO. And then one of the most important aspects is the country profile. And that's in the lower right corner of your screen. So this is where all the data reported by a country is reflected back in a 1-page PDF that countries can, and researchers and advocates and early career nurses and can use for their own purposes. So it shows these globally standardized indicators for each country. And there's some projections to 2030 on there as well. These are also available in each of the WHO official languages of the country, so in multiple languages for certain countries. And that was for the purpose of this policy dialogue and decision making, making sure everyone around that policy dialogue table has the same agreed upon validated country level evidence. Next slide. So in terms of the findings, as I mentioned, I'm just going to go over a few of the highlights and why they have significance globally, regionally, and in a policy level dialogue. So as you can see, and the map on the right, that is the the nurses around the world according to the density. So while we had an increase from let's say the world's nursing 2020 in the number of nurses globally, so we had about we're now about 30 million nurses, and we had about 28 in 2020, say the world's nurses 2020. So we're having growth. But that growth actually on the surface is really different by the region that you're in and the income category of your country. So for example, you can see on the map there that the density is shown by the color of the map. So pink and red countries have a much lower density, blues are higher density. So the global average is about 37. But for example, 37 nurses per 10,000 persons. But for example, in the region of Europe, that density was 5 times higher than in Africa and the Eastern Mediterranean region. And in high income countries, the density was 10 times higher than it is in low income countries. We also see, you can't see it on the map, but in fact, almost 80% of the world's nurses are in countries that only represent less than half of the world's population. So we know that is a really unequal distribution. And that means in many countries, they don't have the nursing workforce to be able to provide basic services for maternal and child health and for other services. All those services that nurses provide, they don't have access. So we aren't going to be able to reach these health goals if we have that level of inequity of access. And we also saw that nursing density that it grew, but we didn't have that growth in a lot of the countries. Some countries didn't have any growth at all in the period between the two State of the World's Nursing reports. And while we also had this shortage decrease, we had in 2020, 2020 numbers showed a shortage of 6.2 million. So we have come down from that in 2023, which is the 2025 data is a full year of 2023 up to that year, and that we've come down to 5.8 million. But when we know that growth was highly unequal, and there's a lot of countries that still have really, really low density of nurses. We go to the next slide. I think I show a little bit of other aspects of this. So just these might be hard to read, but when you look at different country context and regional contexts, there's a lot of difference in the density and the availability of nurses. So we looked at key areas like small island developing states, which have a lot lower density of nurses. And even in terms of international migration, the countries that in the Global Code of Practice are warned against, I should say, you have to have a lot of considerations for recruiting from certain countries, and those densities of nurses are extremely low. So we know those health systems are really struggling to have access to nursing services. And that relates to the extent of international migration and mobility, which is the table on the right. So each of the regions will have different levels, but something that was really stark was the difference in how countries of different income categories rely on foreign-born nurses. So those are nurses that are internationally migrating. Globally, 1 in 7, or about 15% of the world's nurses are working in a country other than they were born. But if you look at high-income countries, it's almost a quarter of the nursing workforce. It's 23%, versus, for example, in lower middle-income countries, it's 1%. And low-income countries, it's 3%. So there's a huge difference on the reliance of foreign-born nurses in high and low-income countries. And go to the next slide, please. So with the data, we can also look forward to 2030, which we did. And although we will see an increase in the stock from currently about 30 million to about 36 million, you can see in that donut graph on the right that the growth is not going to be in the places that we need. Those are the regions that are going to see the most growth. And it's not in Africa. It's not in the Eastern Mediterranean. And while the shortage is also going to decrease from almost 6 million to about 4 million, it's actually going to become more concentrated in only 2 regions. And that's the graph, that's the map that shows like where that growth is going to happen. And in those regions that were some of that pink and dark red in the density, the current density, they're still pink and red, pink in there, meaning they're not going to see growth between now and 2030. So it's actually deepening, worsening inequity that we're projected to see unless we can make some changes now in those policies and encourage now that type of investment. Otherwise, we aren't going to achieve that universal health coverage, which is at the core of Sustainable Development Goal 3. Next slide, please. We looked at a couple other aspects about the nursing workforce that have a lot of relevance when you think about what countries do with this data. For example, we saw that the types of nurses around the world are overwhelmingly professional nurses as opposed to associate professional nurses. And this matters because of that aspect of how you utilize nurses. So if you have professional nurses with a wider scope, can operate, scope of practice, that can operate more autonomously, that impacts where and how you use nurses, right? So if you have a primary healthcare setting where nurses are doing a lot of autonomous practice in different health settings and managing chronic disease and managing a lot of the maintenance of health issues, you can use those nurses differently than if you have predominantly associate professional nurses. We also saw something interesting in terms of the aging of nurses, and that's the bar graph on the right. So those nurses, for example, in certain regions have a lot of younger nurses. For example, if you see those blue bars, for example, in Southeast Asia and the African region and the Eastern Mediterranean, they have a lot more younger nurses than older nurses. And that's what you want for replacement of nurses. Well, you do need a balance because you can see some of those countries that have a smaller amount of older nurses, that they're also important for mentorship, and you want to be able to retain those nurses as well. There's about 20 countries where the nurse is expected to retire are more than the nurses coming in to the profession. So that's an issue, obviously, where we need to work on retaining the nurses that are there, as well as encouraging nurses to come into the workforce. Because if you have all of these nurses retiring and not enough nurses coming in, that's a really big issue for planning. And depending on the country context, they might be looking to recruit from other countries. So these are the types of areas where you really need to then think about how you're maintaining that nursing workforce without recruiting from other countries, and how you're retaining the nurses that you need to. Next slide. I added this slide in because it shows actually on the right-hand side a study done by OECD about the percent of high school students interested in entering the nursing workforce. And they did a study at 2 points in time, 2018 and 2022, in I think 40 or 60 countries. So, and we saw actually a decrease in many of these countries in terms of intent to go into nursing. So a lot of them some of the biggest decreases were in these high income countries where we're already concerned about the number of graduates and the aging profile of the nursing workforce. So this gives a little snapshot into the production pipeline of nursing graduates in the countries that to be concerned about that. So we do look at this number, WHO, this graduation rate. So we saw that based on the State of World Nursing 2020, we saw we needed certain countries that had a shortage and most of those in low and middle income countries, to really increase their production of nurses, their nurse graduates. And actually, since 2020, we saw an increase in that rate. We saw countries in Africa and the Eastern Mediterranean above the global average and above the high income countries in how many nurses and midwives or nurses they are graduating, and that is great. That's some of the numbers in that table there. So that means that they are increasing the production of nurses, which is great. However, we're seeing actually when you look at those graduates per population, they're still much lower than in high income countries. So that means we still have some work to do in terms of getting that access and that equity of availability of nurses in in low and lower middle income countries. And we see that high income countries have fallen below the average in terms of graduating nurses. So that also relates to then how they're maintaining their nursing workforce, how they're retaining them, and managing international use of foreign-born nurses. Next slide. Also looked at aspects of graduation, like the duration, the 3 and 4 year education, as well as these quality mechanisms about accreditation. I won't go into all of them now, but we did see an increase in this kind of trend from Nursing 2020 in 3 and 4 year programs of nurses. That's the primary length is 3 and 4 years, and accreditation is largely in place. And there's some areas that were falling, but that were a little bit concerningly low globally, and that was some of those are related to having interprofessional education, where we saw that was actually about only 62% of countries are educating nurses and have interprofessional education as part of the mandatory curriculum, and social determinants of health in the nursing curriculum. So when we talk about primary healthcare, we want to make sure, and nurses leading service delivery in certain models and settings of health service delivery, they need to be able to work in interdisciplinary teams and be leaders in interdisciplinary teams and understand social determinants of health as a key area of primary healthcare and service delivery. So those are some areas that we know as a profession we can do better on in educating our nurses. Next slide. Then in that area of service delivery that I talked about were regulations and working conditions, we saw in terms of professional regulation that they're really widely in place, and over 92% of countries had a nursing regulatory body, which is great. And we had countries, for the most part, had initial competency exams, so licensure exams. Most countries had continuing competency. The thing we could not look at, which is a key consideration for countries, is the scope of practice of nurses. Is that updated? Does it reflect the education and training and the full extent of that education and training? And that is important in terms of what are the services they're able to do in their settings, and that's the services that can then be provided to communities to improve their health. And there is a wide scope, the scope of practice must be updated and relate to the education and training, which also needs to be updated for nurses and midwives. We did see an increase in advanced practice nursing roles in countries reporting using advanced practice nurses. And we know this is important development in terms of increasing that access, as well as the quality of care, cost effectiveness. So for so many reasons, that is a really positive development. And that was an increase from the State of the World's Nurses Nursing Report 2020. And then in terms of working conditions, we looked at about 20 different protections that should be in place for work settings for nurses and midwives and all health professionals. And for the most part, we saw the basic ones in place. We were concerned about global numbers that showed less than 60% of countries had protections from attacks on nurses, and also only 42% had mental health and well-being packages and services offered to nurses in the work setting. We also looked for the very first time in this State of the World Nursing Report at entry-level salaries and wages. We standardized to the US dollar and found that the median entry-level wages were about $775 per month, which is not very much, but it did differ a lot by income category and regions. That median wage was about twice as high in high and upper middle income countries as low income countries. We also did this standardization by purchasing power parity, and that's the bar graph down here. So in terms of this, you can also see that the purchasing power of entry-level nursing wage was twice as high in high income countries as in upper middle income countries. So it's twice as high there and 3 times as high as low income countries. We also did analysis with countries that had a really robust data that we could dive in and look at a gender pay gap. And we found that within the 31 countries that we had a 7% gender pay gap. So when we think about that issue of retention and what was happening, for example, in countries that might be increasing their production of nursing graduates, so if they have a high level of graduates, but not yet a high level of nursing density or nurses in the health system, some of that is going to relate to the working conditions. For example, if you've graduated a lot of nurses, but you don't have a safe, supportive work environment, you have low wages, you're fighting against a gender gap, that might be reasons that nurses are either not taking jobs in the health system, or they're looking for jobs in other countries because of the situation in their own health system. So these are all pieces of the same puzzle that relate to that overall issue of access and global health equity that we were talking about in the very first slide. Next slide, please. So the last area then is leadership. And we have those two aspects, the senior nursing and midwifery leadership, and then also the next generation, the young leaders, the early career nurses who we need to be the next generation of leaders. So we saw that overall there was an increase in the number of countries that had this position of government chief nurse, which is great because that was in the global strategic directions. That was one of those 12 priorities. And we really did see that increase from 71% 5 years ago. One area that we are seeing into that we couldn't really get at in detail in the World's Nursing Report is what are the responsibilities and the roles and the authority of these government chief nurses? Are they on par with their counterparts in the Ministry of Health who are managing, say, the medical workforce or the health workforce broadly? So that's something that we're looking into in more detail. We did see a really big difference in the availability of leadership development programs. We saw overall there was this global level of 66%, which is great. However, when you look by income category, it's a huge difference. 80% of high income countries have development programs for early career nurses, but only 20% of low income countries have those. And so that is a big difference that we need to work with countries to address so that those leadership opportunities are available to all the early career nurses and midwives. Next slide, please. So our conclusions, our major takeaways from the State of the World's Nursing Report are really about the fact that while we see those global level improvements in the stock, the number of nurses, the density, overall numbers of nurses, the shortage has decreased, the projected increase is there, the projected decrease in the shortage of there, the number of graduates is increasing, all these aspects of the regulation and some aspects of the service delivery environment are improving. Really, that global level of improvement is masking deepening inequities and differences between certain regions and definitely between income categories. So we really have a lot of work to do to make sure that we are all advancing together. As Gemma talked about in the very beginning about our sharing a common ethos and a common values about everyone advancing and getting stronger health systems, having the leadership of nurses towards stronger health systems. It's a really inequitable, unequal picture right now that we need to address. So in terms of addressing those policy priorities, it's what we found in the State of the World's Nursing Report, and this was the conclusion of the World Health Assembly in 2025, that these strategic directions, these 12 policy priorities, are still highly relevant, and these are still the 12 that we need to be working towards collectively to strengthen nursing midwifery in all of the countries and address these global inequities. And what we did in the State of the World's Nursing Report was to take each of these 12 policy priorities and identify the key areas that need to be addressed to move forward. So for example, in that area of jobs, when I talked about those 4 areas, we know that, for example, high income countries need to work on, for example, like the nurses going into the profession. They need to work on retaining their older nurses. They need to work on not maintaining, not having recruiting, having such heavy reliance on foreign-born nurses. Low-income countries, for example, need to work on increasing that graduation rate, getting those graduates into the health system and retaining them there, working on those working conditions and other aspects. So there are these identified policy priorities. And then what we've been doing since then, I'm not sure if I have another slide after this. Right. Okay. So these are the global agenda then. When the World Health Assembly extended the global strategic direction, so the State of the World's Nursing Report was a really key piece of data and information, and after which the World Health Assembly decided to extend the global strategic direction, so those 12 policy priorities. And based on this, the State of the World's Nursing Report, there were 5 additional key areas that we know are important globally and for country level dialogue, and those are to further advance practice nursing, to harness digital health technologies and AI, to work on these policies that are gender responsive and supportive so we can advance towards gender equality, to increase the roles of nurses in the climate and health agenda, and GCNMOs have an important role there, and to support nurses in fragile, vulnerable, and conflict affected settings. So together, these 12 policy priorities with the key areas of focus that are outlined in the State of the World's Nursing Report and these 5 new areas, that is our global agenda through 2030. And that is what we are working with countries and with supportive partners to dive into how within this global agenda, how we support countries in their own country context and to address these issues. Next slide. So that is the work that we're going to hear about today. The World Health Assembly had that decision on nursing and extending the strategic directions for nursing, as well as these other key areas that they talked about in terms of that international migration and mobility and recruitment of health workers, and a larger picture of the health and care workforce overall. So we have this direction by the World Health Assembly to focus on these issues, including advancing the strategic directions for nursing and midwifery. So that is some of the discussions you'll hear about today is in these sub-regional contexts, in these country level dialogues, how are they using their data from the State of the World's Nursing Report and and how are chief nurses and chief nursing midwifery officers leading that process to use all of the data at their fingertips, all of the data available in their country to lead that policy dialogue, be part of the global discussions on identifying priorities for strengthening nursing and midwifery, having the dialogue, identifying what are the key policies, what are the investments, what are the changes that need to happen in alignment with the global guidance, the global strategic directions. So you are really lucky to be able to have some of these wonderful, some of the best examples of nursing leadership that Nursing Now Challenge has organized today to talk to you about how they actually do it in their country, how they have used the State of the World's Nursing Reports and that process of dialogue and decision making and policy development to address the issues in their countries, and how they have done that in the following the State of the World's Nursing Report. From my perspective, the global level, we've seen it happen in over 40 countries since the launch of the State of the World's Nursing 2025 through our WHO regional offices and the country offices, and with partners like Nursing Now Challenge and ICN and others. We've had a really exciting year, and we have a few of the government chief nurses going to explain it to you today. There are even more examples that have been happening around the world, and we hope to support with our partners, with support from the Burdett Trust for Nursing and partnership with Nursing Now Challenge. We are able to continue to support countries and subregions to do this process, this data dialogue decision making for strengthening nursing and midwifery towards universal health coverage. So excited to hear more about that and to take your questions and hear your perspectives on what can be done and how to engage early career nurses in these different discussions. And we won't need that extra slide unless some of the questions are about data reporting. So thank you very much. I look forward to our discussion period coming up. Thanks.
Thank you so much, Carey, for such an insightful presentation. It makes you realise, doesn't it, the power of data and how this data is being mobilised by our senior leaders across the world to draw attention to the areas that need most action within their context, but similarly where there's disparities across the world and where decisions made in one country is having an impact negatively on the health coverage of care provided by registered nurses in another. These are really critical conversations for us to be having on this global platform. Now, as Carey mentioned, we are really privileged to have examples of how senior nursing and midwifery leaders have utilised this data in country. And I'm really pleased to introduce you to Dr. Samaya Alabushi, who is Director of Nursing Department and Head of the National Committee for Nursing and Midwifery Affairs in UAE. She's joining us live today to share those experiences and to give us insight into how this data and these recommendations have taken life within her country and her context. Many thanks for being with us. Over to you.
Thank you very much for everything. Let's start. Good morning, good afternoon, and good evening to colleagues joining us from across the globe. On behalf of the United Arab Emirates, I extend my warmest congratulations to every nurse and midwife around the globe on this International Nurses Day. Today we celebrate a calling. We celebrate a daily act of courage and a compassion and sustains health system worldwide. Thanks a lot to Professor Gemma, Stacey, and the Nursing Now Challenge team and Carey. Thank you for this honor and for your tireless leadership. Now, grounded in the State of World Nursing Report of 2025, what did the United Arab Emirates do? I'll try to give some brief. My apology, I did not prepare slides, but I do memorize everything because on a daily basis, we use the State of World Nursing Report and the data to take a lot of decisions. So the report gives us actually invaluable evidences. And I was part of the State of World Nursing Report of 2020 when I worked with Carey about the whole nursing status. And I worked a lot within my country to strengthen, first of all, the data, which is the state, the National Health Workforce Account. And I think each country, they have a focal point. So I work with a focal point with, of course, with all of the stakeholders together to make the country profile visible in order to be able to understand the story of real progress. If you notice the report between 2020 till 2025, the second report, that today United Arab Emirates has 62,718 nurses serving population of over 11.9 million. And this is reflecting a density of 61.2 nurses per 10,000 population, which places the country well above the regional average and align with the global benchmark, we can say. Now, our nursing workforce is 80% female, as you see in the report, and 20% male, and we are actively working to make that actually aspirational career for all, regardless of gender. And through national awareness and education campaigns, we are trying to target the male students to join the workforce more. We are proud that our majority of nurses actually meets the established, all of them meet the established professional standard. And that's related because of the continuous investment in quality, regulation, and credentialing. Now, every year, I remember in 2020, when we had a COVID, we had barely few Emirati students are within our health workforce. Today, you can see more than 2,500 nurses students are studying nursing. They entered the nursing workforce. And this is supported by a national education framework that was developed based on the recommendation of the State of World Nursing Report. So we have a ratio of 4 nursing faculty per program, and that ensure the quality of education capacity as we grow. What we did further, those numbers did not happen by chance, actually. I remember when we started also in 2020 that we had only few faculty of nursing, colleges of nursing. Now we have more than 15 colleges of nursing that are providing the program. We used to have 0 program on midwifery. We have now 4 midwifery programs at the country level. And we have many of our programs. And yesterday we had a celebration, one of the our university who got ASEN accreditation for the nursing education curriculum for undergrad and postgraduate. Now, we launched also the UAE National Competency and Professional Practice Framework for Nursing, because as you notice, the number of national nurses are low within our workforce, and the country will strengthen the national workforce by unifying the standard for education and competency framework for the nursing. And that was developed, of course, by the Ministry of Higher Education and in collaboration of all health authorities and academic institutions. So the policy dialogues that talk between the stakeholder within one country is very, very important. Acting as a government chief nurse, so we have the CNO forum that we do it on annual basis to meet all the private sector, public sector nurses, CNO, and understand from them all the challenges and show them the recommendations and what we have to do. And in terms of workforce and employment, we launched the National Strategy for Nursing and Midwifery, and that's the clear roadmap because we wanted to strengthen the system. And the roadmap is from 2022 till 2026. And we are going to extend actually the roadmap based on the strategic direction of nursing and midwifery for the WHO. Focusing on recruitment is a big an issue. We are targeting it. Retention is most important because in the beginning, we invested in education. We wanted more students to join the profession. And now retention is very, very important. Career progression is very important. So what we had a guide developed at the country level, which is called the Nursing Career to Specialization. So to understand the nurses that it's not only an admin career path, but it's a specialty, clinical specialty that are important for the country moving to advanced practice nursing, where we set a lot of regulation to govern those specialty. We have a list of a specialty. We keep on updating on annual basis. So we have nurses move from registered to specialization to advanced practice of nursing. And of course, emeritization is a key performance indicator of the whole strategy. When you come to leadership, we introduce a lot of residency program. We had an advisory committee at the country level to understand what type of specialization that are required to empower our nurses, particularly Emiratis, to advance into clinical specialization, as well as leadership roles. So the majority of CNOs of all hospitals are the national workforce. We did a lot of work in terms of regulations and mainly the scope of practice of nurses, as well as the scope of practice of midwives. We did put standards for both professions. We did a lot of guides and communication. And also we had a clear website, which is called the National Committee website, where we update for any guides, any documents, any policy that are there. We're always visible on the table. We try to push nurses to go for any public health programs and the policy, ministerial meetings and everything. We're proud for that commitment. Looking ahead, what makes the moment even more exciting in the United Arab Emirates, bold national direction toward agentic AI. And under the directives of our leadership, the country government, the wisdom, they have announced that we need to become the first, or to move the services that we are providing to the client 50% to be deployed by agentic AI models. And this will, of course, support the nurses a lot, because we are trying to keep them, to pull them back to the bedside. And AI is going to support them in terms of getting rid of all those admin jobs, the unnecessary calls, the unnecessary data collections, the unnecessary analysis. And I think independently, they will be able to have more time with their patients, better decision maker. And I think this achievement, and while I'm talking to you today, we are celebrating our International Nurses Day. So I left an AI nurse who's speaking to them purposefully to make them understand that we can do a lot of tasks by AI. Of course, AI is not going to replace any one of us, but we need to understand how we are going to support. So moving forward, having the skills of AI plus the technical and specialization, I think will make them brilliant nurses to serve the country in much better way. So for nursing, this means reducing, as I said, the burden, enabling them a smarter workforce planning. We are trying to work a dashboard for the workforce at the country level for the nurses to understand how we can utilize them. And also nurses are always ready, and I think they are the support. We are very glad and very happy, due to our current situation, none of other nurses wanted to leave the United Arab Emirates, and they were really at the bedside serving the patients, happy to live in the United Arab Emirates. We are proud for that also. So a big congratulations to them on this International Nurses Days. Many achievements has been happening throughout this national strategy. As I said, we are progressing. The initiative that we are working in the coming few years on the nursing career path would like to be better paid. And maybe when the State of World Nursing Report, we had no regulation on the minimum wage of the national nurses. There was a few days back a national wages criteria has been put for the country for the national nurses. So the journey reflects what is really possible, and evidence meets the political with and the investment of WHO and the directions. So our nurses are not just the backbone of our health system, they are the heart. And again, I would like to thank you all. Happy International Nurses Day. Let me know if you have any questions, and thank you very much.
Thank you so much, Dr. Samia. That was absolutely wonderful and so inspirational to hear the significance of change that has been enacted throughout the country. What struck me was a real commitment to systems level change, recognising that this wasn't about individual organisations and workforces addressing these challenges in isolation, but actually around how the whole system needed to work differently to create capacity, to educate more nurses, to provide high quality care, and really leaning into the opportunities that technology and the advancements in AI might bring to the profession. It was really heartwarming to hear you say about the professional pride that nurses have within your country and their dedication to improving the health system nationally. Really wonderful. Thank you so much. Now, I hope all of you in our audience out there from across the world felt as inspired as I did listening to our talks so far. You will have opportunity to put questions to both Carey and Samia, so please do pop them in the question and answer box, which is directly under your chat function. And we're really privileged to have Hassan Hussain, who's one of our Challenger Committee members and also Policy and Advocacy Manager at Doctors of the World UK. And he will be able to put those questions to our panel today. Okay, we'll move on now to hear from Sandra Moya Sanchez, who is Director of Nursing, Permanent Nursing Commission at the Ministry of Health in Mexico. Now, Sandra wasn't able to join us live, but has provided us with a short film to again describe how the State of the World's Nursing Report is taken into action within Mexico.
Agradezco mucho que nos hayan dado la oportunidad de poder participar en esta importante actividad. La verdad es que estamos muy contentos aquí en México. Mi nombre es Sandra Guadalupe Moya Sánchez, directora de Enfermería y coordinadora general de la Comisión Permanente de Enfermería. Vamos a hablar sobre el estado de la enfermería en nuestro país y bueno, comentarles algunos aspectos epidemiológicos y fuerza laboral de enfermería en México de forma muy breve, pero sí comentarles que bueno, tenemos 126 millones de habitantes, una realidad y no solamente en nuestro país, sino en muchos otros, pues el envejecimiento progresivo de la población, pues es algo de llamar la atención. ¿Cuáles son nuestras principales causas de enfermedad? Las infecciones respiratorias agudas, las enfermedades infecciosas frecuentes y la alta demanda de atención ambulatoria. Y la carga de enfermedad, como las no transmisibles, las crónicas no transmisibles que predominan, que desafortunadamente pues sabemos que la obesidad, la diabetes, la hipertensión, pues es algo también muy, muy serio, que también es parte de nuestra epidemiología. Y los problemas de salud mental y las condiciones musculoesqueléticas. Esto es nada más para que ustedes vayan observando cómo estamos distribuidas en este país, desde el norte, el centro, al sur, y podemos identificar que aunque tenemos 371.633 enfermeras, solamente es una 2.95 enfermeras por cada 1,000 habitantes. Entonces sabemos que pues sí nos faltan más enfermeras y enfermeros, pero algo de llamar la atención y que sí quiero resaltar es esa distribución por nivel de atención. Como podemos observar, pues tenemos un gran reto, poder tener más y más enfermeras en primer nivel de atención, ya que en segundo nivel se concentra el 57.4 de enfermeras y enfermeros. Que lo que identificamos, que afortunadamente pues hay un crecimiento sostenido de perfiles profesionales y reducción de perfiles académicos, lo cual nos puede ir mejorando la atención que podemos otorgar en los centros hospitalarios, en primer nivel de atención y sobre todo el trabajo en la persona, la familia y la comunidad, que ahí es uno de los grandes retos que tenemos que ir trabajando el personal de salud en este país. Bueno, y hablar de gobernanza de enfermería en México, sí comentarles que existe la Secretaría de Salud, en la cual estamos insertos la Dirección de Enfermería, en lo que es la Dirección General de Calidad de Educación. Aquí tenemos valores, tenemos programas, pero aparte de esos programas que tienen, tenemos que coordinar la Comisión Permanente de Enfermería. La Comisión Permanente de Enfermería nace en el año 2007, entonces, estimadas y estimados colegas, uno de los grandes retos es que quede por escrito en sus leyes que debe existir un cuerpo colegiado que pueda asesorar al secretario de Salud que esté en turno. Aquí ustedes pueden observar, pues en este momento, nuestro secretario es el doctor David Kersenovich, que él funge como presidente, el vicepresidente es el licenciado Eduardo Clare García, en este momento yo como coordinadora general, y como secretario técnico el maestro Sergio Eduardo Matienzo. Pero lo más importante de todo esto es poder trabajar de forma coordinada y poder proponer un plan rector entre todas las instituciones, tanto de salud como educativas. Aquí sí es muy importante que yo me detenga. La verdad es que hablar de planeación estratégica, aquí en nuestro país tenemos el Plan Nacional de Desarrollo que nos da la ruta precisa de qué se tiene que hacer por 6 años. Entonces, esta es la primera vez que sale enfermería en un programa sectorial de salud en donde estamos vinculados a 5 estrategias con 9 líneas de acción. Entonces, de verdad, ahí viene la fuente. La invitación es que ustedes lo lean. Esto es perfectible, por supuesto, pero el que estemos las y los enfermeros dentro de este documento, que es el documento rector para todo un sistema, es algo que a nosotros nos ayuda mucho para poder determinar cuáles son los grandes retos y cuáles son las tareas a realizar. De ahí salió el Plan Rector de Enfermería, el cual también los invitamos a que ustedes pueden entrar a nuestra página y pueden identificar que ahí existe este Plan Rector de Enfermería con 5 ejes muy claros en donde nos permite realmente articularnos con las políticas públicas en materia de enfermería y en materia de salud en forma general. Entonces, estos 5 ejes se vuelven muy relevantes porque al final es lo que tenemos que estar visualizando las y los enfermeros de México, que tenemos que trabajar para poder realmente alinearnos a lo que es el Programa Sectorial de Salud con el Programa Nacional de Desarrollo. Este es uno de los trabajos que hemos estado estableciendo en búsqueda de estar trabajando de forma colaborativa para realmente tomar decisiones y que podamos trabajar todos de forma conjunta para mejorar las condiciones. Aquí este diálogo político se realizó el 19 y 20 de noviembre con la Organización Mundial de la Salud y la Organización Panamericana de la Salud y con nosotros como Dirección de Enfermería de la Secretaría de Salud. Ahí se invitaron a actores estratégicos, a líderes, tanto de instituciones educativas como instituciones de salud, para poder definir cuáles eran esos grandes retos que teníamos que tener identificados y darles una prioridad. Tenemos prioridades identificadas en lo que es educación, empleo, el liderazgo y en la prestación de servicios de salud. Como ustedes pueden ver, en estos puntos sí es importante identificar que cada uno de estos va a llevar un nivel de desarrollo para poder incidir en que realmente estas prioridades puedan ser abatidas con estrategias que sean a corto, a mediano y a largo plazo. ¿Cuáles son las acciones estratégicas que se llevan en este momento en este país? Uno de ellos es el programa Salud Casa por Casa, en donde nosotros como Secretaría de Salud estamos trabajando muy de la mano con esa secretaría, que es la Secretaría del Bienestar. Ellos no son parte de la Secretaría de Salud, son otra Secretaría de Estado, en donde ellos identificaron a través de sus funcionarios que estaban trabajando casa por casa en cada uno de los estados de la República, que había una gran necesidad de que realmente hubiera personal de salud yendo a los domicilios. ¿De quiénes? De la población vulnerable. Aquí sí, de verdad, decirles que el 90% del personal que es contratado por esa secretaría es enfermeras y enfermeros. Eso es algo muy bueno para nosotros como directriz, porque estamos haciendo la rectoría para que también esas personas que aunque no son de la Secretaría de Salud, vayan con un camino muy claro de qué es lo que deben de hacer con esa población. Esa población vulnerable son las personas con algún tipo de discapacidad o bien las personas mayores. El segundo punto es, como una acción estratégica, fue la actualización del acuerdo de prescripción de medicamentos por enfermería, porque eso va ampliando nuestras facultades y funciones como tal en el sistema. Se está desarrollando el modelo de atención para el fortalecimiento del rol de las enfermeras licenciadas, el cual busca fortalecernos como enfermeras y enfermeros y que realmente se dé la consulta de enfermería en el sistema de salud. Y no solamente una consulta presencial, sino también esta cuestión de la telesalud, que puede llegar a un mayor número de personas y eso podemos incidir para mejorar la atención. Con ustedes trabajamos apenas el 28 de abril de este 2026 en una escuela de la Cruz Roja, una escuela con más de 100 años. Vean ustedes, tenemos que hacer esta vinculación con todos porque nos interesa mucho poder trabajar para poder llegar a un mayor número de enfermeras y enfermeros. Este webinar híbrido se llamó Cuidar con Presencia, fue Nursing Now Challenge. Entonces tenemos que trabajar de forma colaborativa. De verdad, muchas gracias. Estos momentos de poder compartir con ustedes son momentos muy importantes para poder hacer cosas diferentes para las y los enfermeros y podamos ser un marco de referencia. ¿Cuáles son los siguientes pasos? Se espera realmente de forma progresiva ampliar, avanzar hacia el rol ampliado de enfermería a una práctica avanzada. Eso tenemos que hacerlo con estos cambios laborales, en la cuestión educativa, con las universidades, poder identificar cuáles son las mallas curriculares de acuerdo a ese panorama epidemiológico y dejarlo de todo de forma normativa y legal para que podamos realmente ir transitando a que esto pueda darse como una de las formas de poder llegar a un mayor número de personas. Esto es lo que estamos haciendo, estimadas y estimados colegas. En pocas láminas quisimos sintetizar en dónde estamos, pero sobre todo a dónde vamos y qué es lo que estamos buscando para las y los enfermeros, pero sobre todo para la población que está en nuestras manos. Con esta lámina yo termino, agradeciéndoles el poder compartir con ustedes. De verdad, están los correos abiertos, están los teléfonos abiertos para que realmente podamos tener un acercamiento y poder decir cómo podemos ir mejorando, que realmente se dé esta posibilidad de que el poder de la enfermería para cambiar el mundo. Entonces, pues estamos ahí muy atentos a sus comentarios. Ahí cualquier situación, estamos desde la heroica Ciudad de México para ustedes. Muchas gracias.
I'd like to introduce you to our next presenter, which again is joining us via audio. and this is Deepika Kakaya, Nursing Advisor and from the Government of India. Again, this will be a video presentation. We'll just take a moment to allow the team to get that set up and lined up for us.
Greetings from Ministry of Health and Family Welfare, Government of India. I would like to wish all the nurses a very happy International Nurses Day, and I would like to thank Nursing Now Challenge for giving me this opportunity to speak at this esteemed platform. I would be discussing the key initiatives and the best practices in India for excelling and advancing professional excellence. Nursing is the center of the global health agenda, and India's priorities align with the international framework in shaping the future of the profession. And as per the State of the World Nursing Report 2025, WHO highlights on the workforce gaps on education needs and leadership opportunities globally. And WHO strategic directions highlight the 4 policy priorities, that is quality education, employment, jobs, and leadership. And it is imperative that these are aligned in achieving the universal health coverage and sustainable development goals. SON report had mentioned India's best practices, highlighting the midwifery initiative and the expansion of rural healthcare and midwifery services at the periphery, and educational reforms. We have recently working on expansion of the nursing education infrastructure by committing to open 157 nursing colleges, co-locating with medical colleges, and annually increasing the seats to 15,700. Nursing registration and tracking system is also a central real-time tracking system, which is there because India being a democratic republic, we have 28 states. So this is a central tracking system, which would enable us, this tracking system would enable us for workforce planning, forecasting using of health labor market lens. For building strong foundation, there are certain initiatives which have been taken up by our division. That is an induction training program for new recruits to equip them with the necessary skills, confidence, and competencies to take up their role as a nurse at the bedside. And we have chalked out and disseminated nationally clear job responsibilities, highlighting both the clinical hierarchy and the different job roles and responsibility as per the clinical job profile, and also the different roles and responsibilities and the different teaching cadres to deliver quality nursing education. Recently, India in 2020, the nursing regulator had launched a competency-based curriculum for improving clinical proficiency, critical thinking, and leadership skills, ensuring global competence. I mentioned this, that we have expanded and added to 157 nursing colleges, which are to be co-located with medical colleges across the country. Some landmark reforms which have been taking place in India, which is transforming the nursing governances, that we have a new National Nursing and Midwifery Commission, which has come into play in 2023, which ensures robust regulation, transparency, and accountability across education and practice. And I had mentioned about this National Nursing Registration and Tracking System, which is a digital platform for real-time registration, verification, and strategic in workforce planning nationwide. We have nursing norms, which we are currently following, which is a standardized guidelines for staffing and workload management all across our healthcare settings. Since the SON report also mentioned that there is substantial evidence to say that nursing is a high stress profession and there's high percentage of burnout seen in our healthcare professionals, especially nurses, there are certain initiatives which we have started from the Government of India, that we have a student wellness program for nursing students addressing their burnout. It is preventive and promotive in nature. Then once they join, we give them support. We have a buddy system to help them in case they are facing some challenges. Then for capacity building, we have CHO, which is a new cadre which has recently come up, which is called community health officers. These are nurses who are independently manning our sub-centers, and we have done capacity building for these community health officers so that there is mental health promotion, prevention, and early detection and referral. In workforce policy development, we have made some guidelines for working conditions for nursing professionals. for standards of promoting supportive and safe workplace environment. And we are also working on modernized recruitment rules for reflecting evolving professional standards. These are some photographs of snapshots of the activities which we had done, and a very senior level healthcare leadership was present in the launch and the running of this program. India is producing more than 300,000 nurses every year, and it is imperative, since we are producing a big bulk of nurses every year which are adding to our service delivery. It is important to invest in the nursing education and nursing educator, and we ensure that the nursing students should receive world-class training from educators who are empowered, who are equipped with the contemporary skills and knowledge. So we are running a faculty development program all across the country in different states as per the learning needs which have been identified among these nursing educators. Midwifery initiative is another flagship program which the government of India had launched in 2018, which creates a cadre of nurse practitioner midwife in India in accordance with the prescribed International Confederation of Midwives mandate. And they are knowledgeable and capable of providing compassionate, respectful, women-centered maternal and newborn care services to our women and children. As I was mentioning, this new cadre which has come up of community health officers, there was a national program called Ayushman Bharat, which focuses on a cashless health insurance to vulnerable population. PMJ is for establishment of our health and wellness centers. They are now called, there are sub-centers which are now called as AAM, which is Ayushman Arogya Mandir. They provide comprehensive healthcare services to the community, and they also work towards a universal health coverage. So preventive and promotive services are given by delivering screening for NCDs, for cancers, for immunization, maternal and child health education at the community level. And they bridge the gap between the urban and the rural by bringing quality care to the underserved population, taking everybody along, giving services to the last mile, leaving nobody behind. Some best practices across states are that we have a fast online registration. Then we have AI blockchain integration, which is advanced administrative technologies ensuring data security and transparency. And for access to continuous education and capacity building of the healthcare professionals, we have e-learning platforms. We recently had a national level high consultation meeting in which we had also disseminated the SON report, and there was leadership from all over the states which was present, and we also talked about the best practices. So we have when we discussed the best practices all across the states, there were these 4 thematic themes which came on quality assurance, faculty development, global mobility, as the SON report highlights that 1 in every 7 nurse does not work in the country of our origin and works elsewhere. So India also has a very high mobility of Indian nurses going all across the world. So we have international placements partnerships, we have state license exams and global competency standards. And career awareness is also one of the best practices. We're trying to get good students from the schools to join nursing as a profession. We have mentorship initiatives and increased career interest. Keeping in view the 4 policy priorities from the center, India is a state, we have a federal government. We have established under the guidance and the strategic nursing norms, we have made 4 technical advisory groups to work on these 4 policy priorities from some senior leadership all across the states. And these technical advisory group comprises of national experts, policymakers, academic leaders, and state nursing registrars. And they are aligned with the national priorities and global framework. Just in a snapshot to show India's progress on SON report recommendations, we are working on these areas of education alignment, national nursing norms, which is under process. We recently had a competency-based curriculum. We are working on a new regulator, which has been passed by our parliament. Then we have scaled up the production of nurses. The government has announced 157 nursing colleges, which I've already mentioned. Then we have faculty development program. We have curriculum reforms. We have digital learning. We have a national digital health mission and digital learning nursing platforms which are in progress, and they are building our access to remote rural areas. Then there is scope of practice and continuous professional development. We have regulatory strengthening. Workplace conditions, we have national nursing workforce strategy under development. We are working on legal protection for some legal provisions for protection of assault on healthcare providers and enforcement agencies. Then we have mental health support programs for our healthcare providers and nurses, which initiative we have started from the Ministry of Health and Family Welfare here. Then we have advanced practice roles. We have a nurse practitioner program, which are running in 19 states and 31 institutions. And we are providing healthcare services to the underserved population by recruitment of these community health officers, which are providing the services in rural and tribal areas through our national health mission. The recommendations are to invest in nursing education and employment with clear pathways for career advancement, leadership roles, and participation in policy making. To strengthen nursing leadership, enhancing development programs, and building capacity building and cadre creation. India has the senior most nursing position, like I am the nursing advisor, which is kind of the senior most nursing position in the country. And as per the SON report, in CRO region, around 78% of them have a government nursing chief nursing officer. To ensure a fair and safe pay and working conditions across private and public sector, healthcare sector, to integrate nursing health policies, research, and primary care to maximize contributions, and to identify new nursing roles through sustained capacity building initiatives, and to analyze the data which is generated from the NRTS registration for policy inputs and nursing workforce projections. These are the glimpses of the national level leadership workshop which we had, in which we disseminated the SON report findings and also tried to assimilate the best practices all across our states. This was for this program, we had very senior most leadership of the country present. Like we had health secretary, we had member of Niti Aayog, who was equivalent to the Minister of State, and we had WHO WR who was present during that meeting. It was very widely covered in the media, and it was very well taken that this dissemination was done all across the states, and we are still working on the areas which are the policy priorities, how we can work on this all across the states. So these are some of the snapshots, and this was covered by the X handle of the Ministry of Health. I would like to wrap up by saying that nurses are the backbone of the India's healthcare system, and we are committed leadership. We have strategic investments and global collaboration, and India is poised to build a stronger and a more equitable nursing workforce. Nurses are essential. India is committed through policy, governance, and investment are aligned for progress, and collaboration is the key. Global partnership will accelerate India's nursing transformation, and we know a strong nursing workforce is a foundation of a strong nation's health system. So thank you again for the opportunity.
Wonderful. Thank you so much. What an insight that has given us. I think there was something very powerful in both of the examples we've heard so far around the emphasis on developing the nursing faculty and the university provision as really that starting point to how we do strengthen both attracting great candidates into nursing, but then offering them the very best educational experience to make sure that we do have graduates and that have the capability, the competence to thrive within the profession. And we'll be picking up that thread around education in our afternoon debate as well. So lots of opportunity for us to consider what this might mean and how we might want to influence how those developments are being taken forward in the different countries. We're moving on now to our next video, which is going to be shared by Anastasia Jordan, who is the Chief Nursing Officer at Barbados Ministry of Health and Wellness.
And midwives. Fellow nurses and midwives, Before I begin my presentation, I wish to first convey that I consider it an honor to have been invited to deliver this presentation at this International Nurses Day webinar hosted by the Nursing Now Challenge. I therefore wish to compliment Nursing Now Challenge on your remarkable commitment to empowering nurses and midwives across the world. Through your efforts, you have created a valuable platform for developing leadership skills, fostering professional growth, and encouraging innovation within nursing profession. I'm particularly delighted to present on the topic, Strengthening Nursing and Midwifery in Barbados, Aligning with Global Directions for Health Equity, because it speaks directly to both our national priorities and our shared global responsibility to build resilient, equitable health systems. In Barbados, nurses and midwives are at the heart of care delivery, and strengthening these professions is essential to addressing our evolving health challenges while ensuring that no one is left behind. Fellow nurses and midwives, the State of the World's Nursing Report 2025 reminds us that while progress has been made, inequities remain. For Barbados, our journey shows that even small nations can achieve near universal health coverage and strong health outcomes. But we must now adapt to new realities. The rising burden of NCDs, the re-emergence of non-communicable diseases, growing elderly populations, and the impact of climate change, especially on small island developing states like ours. On a global level, Barbados adheres to the principles of WHO's Strategic Direction for Nurses and Midwifery, along with guidelines from the ICN and ICM and the regional nursing body. These frameworks focus on leadership, education, service delivery, and regulation, and are all integrated into our national strategy. This strategic alignment helps ensure that Barbados meets both regional and global health goals. Barbados has taken deliberate steps to strengthen nursing and midwifery in line with WHO's strategic directions under the policy headings of education, jobs and workforce development, leadership, and service delivery. In this regard, Barbados has strengthened nursing and midwifery by expanding, for example, our midwifery program from 1 year to 18 months, investing in continuous professional development, and integrating leadership and public administration training alongside additional specialty education to build governance capacity. Additionally, we have sustained over 98% skilled birth attendance, maintained a stable workforce despite migration pressures, and led the development of a 10-year strategic plan for nursing 2025 to 2035 to align with workforce development with future needs. In addition, there is a strong national drive to fill all nursing vacancies to achieve optimal safe staffing levels, improve remuneration in line with qualifications and responsibilities, and expand career pathways through the creation of new nursing posts that support professional growth and advancement. In 2025, Barbados, for the first time in history, appointed a chief nursing officer with a background in midwifery. This ensured that nursing and midwifery are represented at the highest policy level. In this context, this action aligns strategically with the call to ensure both professions are recognized and involved in policy decisions relating to building resilient health systems and achieving universal health coverage. Our maternal mortality ratio remains between 35 to 39 per 100,000 live births, and neonatal mortality at 7 per 1,000, outcomes that compare favorably within the region. Nurses are well integrated into primary care, adolescent health, and community education, and are increasingly contributing to climate resilience and disaster preparedness initiatives. Looking ahead, Barbados is investing in nurse practitioner training to expand public health access. Currently, in partnership with Chamberlain University, we are training 30 nurse practitioners in a variety of nurse practitioner areas such as adult general, family practice, and mental health. This initiative is designed to strengthen primary care delivery, enhance the management of growing burden of NCDs, such as diabetes, hypertension, and cancer, and respond effectively to the needs of an aging population by ensuring continuity of care and dignity in later life. By advancing nurse practitioner roles, Barbados has directly aligned with WHO's call for advanced practice nursing to strengthen service delivery, equity, and resilience. Beyond meeting our national needs, NP training also reflects the priorities of the State of the World's Nursing Report 2025 and WHO Strategic Direction 21 to 2030. It addresses workforce shortages, builds resilience against migration pressures, and expands equity and access to care. It creates advanced practice pathways that elevate nursing into leadership and governance, while ensuring that our health system is future-proofed against the rising burden of NCDs. From the perspective of the SDG goals, NP training contributes directly to SDG 3, good health and well-being, by strengthening primary care and chronic disease management. SDG 5, gender equality, by elevating women into advanced autonomous roles. SDG 8, decent work and economic growth, by creating skilled jobs and supporting retention. And SDG 10, reduce inequalities by expanding access for vulnerable and underserved populations. The key message is clear. Barbados is not only addressing local health challenges, but is also showing how a small island developing state can lead globally by implementing the recommendations of the State of the World Nursing Report and the WHO Strategic Direction for Nursing and Midwifery. Our nurse practitioner initiative is both a national reform and a global contribution to building stronger, more equitable health systems. Our priorities emphasize professional recognition. Barbados has advanced plans to amend the Nurses Act 2008 to expand the scope of practice for midwives, with the long-term goal of establishing midwifery as an autonomous profession and positioning it as a viable solution to workforce shortages, sexual and reproductive health, and adolescent health. At the same time, regulating advanced practice nursing will define clear scopes of practice, strengthen accountability, and ensure quality standards. These reforms will create structured career pathways, elevate nursing roles in clinical governments, and position advanced practice nurses as leaders in delivering equitable, resilient services. Leadership development will establish pathways for nurses and midwives to assume senior governance roles and strengthen their capacity for decision making. By leading policy formulation and implementation, they will align nursing and midwifery frameworks with universal health coverage and health equity, embedding their expertise at the center of national planning and driving sustainable health outcomes. Strategic implementation will be guided by the rollout of the 10-year nursing strategic plan across the 3 areas: governance, education, and legislation. More than administrative, this plan is a roadmap for transformation, aligning national priorities with the WHO Strategic Direction and the SWAN Report. By embedding these frameworks, Barbados strengthens its workforce, advances leadership, and expands equitable access to care, positioning nursing and midwifery as central to achieving universal health coverage and health equity. Climate and disaster preparedness will continue to embed nursing perspectives into resilience planning through policies, curricula, and training, equipping nurses and midwives to respond effectively to emergencies and safeguard vulnerable populations. Finally, global alignment ensures Barbados reforms contribute to the WHO strategic directions and SDG goals. By embedding national priorities within these frameworks, Barbados strengthens its workforce, leadership, and access to care while contributing to global health equity and system resilience. Colleagues, the story of Barbados is one of progress, resilience, commitment to the global nursing agenda. Our achievements in education, workforce stability, leadership, and service delivery show what is possible when nurses and midwives are empowered. Yet, our mentioned priorities remind us that the work is far from finished. As we celebrate International Nurses Day, let us recognize that our efforts are part of a shared global movement. The SWAN report and the WHO strategic direction calls to act boldly, and Barbados is proud to contribute to this collective journey. Together, across countries and generations, we are shaping a future where nurses and midwives lead in achieving sustainable development goals and delivering health for all. From Barbados, happy International Nurses Day.
Wow, what a wonderful presentation. That was so incredibly inspirational and powerful. Really made me think of how this data, how this policy directive is being utilised to really transform where nursing and midwifery is positioned within Barbados, and really changing the direction of travel in a way that the country has not achieved previously and couldn't have achieved without the support of this global direction. So incredibly inspirational. Now, again, it's my great pleasure to introduce you to Hassan Asin, who is going to lead our question and answer session now, and also to welcome back Carey McCarthy and Samia Al-Balushi to join us on the panel.
Thank you very much, Gemma, and thank you very much for Dr. Samia and for Dr. Carey McCarthy for the amazing session. The question and answer has been just popping up with all sort of amazing questions. Few of them has been directed to you, Dr. Samia, if we're going to start with those. So, in your experience, which is eloquently, laid out how to advocate for advanced nursing roles, what the barriers and opportunities you have encountered, maybe the audience trying to understand your experience and your expertise of overcoming those barriers.
Hassan, would you mention again who that question was for? I couldn't quite hear you.
So that was for Dr. Sumaya, about the experience. Yes, sorry for that.
Okay. Thank you very much. For advanced practice nursing, that would depend on the country how they define the advanced practice nursing, because some of them, they merge the clinical nurse specialist with the nurse practitioner. And then when I was speaking that advanced practice to beyond the bachelor degree, which is the specialty role, specialization, and we are working toward the practitioner role. So the advanced practice nurse in our country consider as the nurse specialist plus the practitioner role. So the practitioner role, we have only few nurses at the country level. We have a license, a clear regulation to become a practitioner, yet we need still a lot of work, and we need to enroll our national workforce into sustainable, because we have transient workforce who come in and go. So we don't have a sustainable system for the practitioner role. Therefore, we are trying to work in advance in the education. As I mentioned, we are progressing. We finished the guide to specialization, and then we will work toward further the logbooks, when you talk about the practitioner, like community health nursing and other specialty, of course. So the challenges mainly worldwide, they depend on, in GCC country, one of the things we have, good coverage of the physicians, but we are doing the practitioner role and the clinical specialist nurse role to give better care to community, as well as to, to stand up for any emergencies or anything. Plus, they are the closer people to the community. So there are certain specialty in advanced practice nursing or nurse practitioner, we want them like community mental health. We are in very bad shortage of those areas. So we are going to move these two areas as a priority for us.
That is very interesting. And I think it nicely linked to the next question for you, Dr. Carey, about the allocation and use of the data. So Carl, first of all, asked about how we might balance taking stocks and looking to the future, and can we do both in reference to your slide presentation, as well as there is a question, I think, nicely linked to this about what are the next steps that we can use or we can take to allocate and optimize the use of the current evidence that we have by government, by organization, and by other players on the wider scene.
Yeah, thanks. Great questions. Absolutely, we can be looking at the data and the stock and some of those hard kind of figures while looking towards the future and thinking about the actual lived experiences of nurses in their country and how planners like Sumaya and the other speakers have demonstrated. Each of those countries reports their data, which helps make that aggregate picture. But what we're able to see at the aggregate picture and doing the State of the World's Nursing 20 and 2025 are those trends and how things are changing. When we just saw the State of the World's Nursing report, yes, we saw that status and we saw that we had growth since the State of the World's Nursing 2020. But when we're able to look a little deeper at the regional experience and country level experience, we did see, for example, that there was, say, no growth in certain countries in African region or some of the Southeast Asian countries or low income countries generally. And then we can use that global picture to look a little bit deeper. Something that I didn't show was one of my favorite graphs from the State of the World's Nursing report, which shows for every country, the level of nursing graduates, so that rate that we saw increasing in low and lower middle income countries, how many graduates they're producing, but then also showed for the same country where they are in terms of their nursing stock, which reflects how they're employing those nurses. And so we did see that some of that high stock of nurses we had, or high graduate levels of nurses, we saw still the low stock. So they're not able to employ those nurses. So that's the sort of quantitative picture, but then we understand what the working conditions are like, which might be more of a qualitative picture of, are these protections in place? What are the wage? What's the issues with gender pay disparities? What's the issue with safety and security and attacks on nursing, or those opportunities for career progression in those countries, whether or not there's leadership development that relates to that career advancement path that Sumaya was talking about. All of these aspects together create the detailed picture that our qualitative and our quantitative data create. And then that is really the experience that we can understand about the nurses in that country. And then that's where the policy responses, like Sumaya was describing and the other speakers were talking about, the policy response has to be specific to the experience of those nurses, whether it be based on the stock and the density and the availability, or if it's related to these other aspects in terms of the gender discrimination they might feel, or the working conditions or the safety that they might feel in their work setting. So it really is both sides of the coin at the same time, and it is a delicate balance. And what we've seen is how these nursing leaders have taken that data and then tread on that fine line of what is the actual response, what is it that nurses need from their government to be able to address those specific experiences of nurses and that broader needs of the health system and the country at once.
Thank you very much, Dr. Carey. And I think there is few more questions about these lived experience intricacies. I'll bring them back to you in a minute. But I just want to go to Gemma and ask this question about how you see organizations like Nursing Now, Better Trust, supporting the infrastructure, fellowships, networks, funding mechanisms that make that leadership possible. And I think it's a question about how we can catalyze the change and operationalize it to be real.
Absolutely. I think it's a great question. And there are, I think, several mechanisms that networks like Nursing Now Challenge can have the type of influence that you're describing, Hassan. And it starts with really educating ourselves. So sessions like today enable us to have first-hand accounts of the data and understand how our policymakers are interpreting that data and where they perceive the action that needs to be taken. we then need to make sure that we create opportunity and platform to bring communities like Nursing Now Challenge into the dialogue that influences the direction of travel, so that those policymakers have insight into that lived experience, and the decisions that they're making are ones that will translate and be valued by those within the workforce, entering into the workforce as students and transitioning in as early career nurses and midwives, so that they can see that there's opportunity for them to have their experience heard and shaped. And the other element, I think, is really about us seeing this as a community endeavour. So it requires us to think about our collective position, facilitate opportunities for us to have debate and discussion, and then to decide on what position we hold as a community that we can communicate on the behalf of that community. So that means people like myself being able to present in different places, but more importantly, enabling members of the community, the Nursing Now Challenge community, to have that stage to speak directly, but to be informed by the perspective of the wider group. And that's really what we're trying to facilitate through Nursing Now Challenge. I think the final element is for us to equip ourselves with the interpersonal skills and the communication skills that enable us to speak with authority within those positions, so that we aren't asking permission to have a view and a voice. We're actually arriving and leaning in with a really strong sense of our expertise and a confidence in that expertise, and we're able to articulate ourselves in a way that means that other influential people around the table are able to understand, listen, and really take notice of what it is our community have to say.
Brilliant. I think in a snapshot, that would be organizational, community, and interpersonal satisfaction, which is the best formula to create any change.
Nicely summarized. Thank you, Hassan.
Thank you very much. I just want to go back to Dr. Sumaya, and you spoke a little bit about agentic AI and how it's transformational in bringing the nursing expertise to the bedside and, helping retaining nurses. But then there is a very good point has been raised in the conversation that there is a gap within the nursing generation. We see frequently new nurses increasingly having been trained using digital and AI tools, but we see a lot of the current and in practice nurses have not had the same level of exposure. How would you recommend that we address this growing gap and risk of digital inequality within the profession?
Thank you very much. I think the gap is there since we are the Millennium and X, with the Z generation. They are totally different. They don't want to be, managed. They would like to be coached and directive, and they are very highly keen to the digital. So we would like, even when we promote for nursing profession at country level, those interests should not disappear when they join the nursing profession. Now, the country directives with agentic AI is really helpful because they encourage all health facilities to use agentic AI, and we would like to increase many services has to be moved to agentic AI. And I can tell you, personally, we use the agentic AI in terms of recruitment process, actually. And we were able to pilot that. And we did, if the nurses are spending a lot of time in reviewing the CVs, the experts that they would like to join. So agentic AI can do huge work, and we could filter 1,000 CVs at a time, and then we moved them to 100, and then we took the best 20, for example. Plus, we took those young nurses and we send them the link that they have a chat and a conversation with agentic AI, interview to understand them where they would like to be in the coming 5 years, what career path they would like. So that is saving a lot of nurse leaders time to understand the nursing profession and understand their professional development. So we were able to assess the need of a workforce that they are working in terms of their work environment, to understand what are the needs, because sometimes We received a lot of emails. I would like to be transferred from this health facility. I cannot do 12-hour shift. I can't do night shift. So we wanted to understand the young generation deep, and the AI was very helpful in getting us all the reports within less than an hour. And we could spend, ages in doing now more things in terms of patient scheduling, predictive analysis. They can give us alarm when the patient is at high risk, and all of these things can support and give more confidence to our nurses. And that's why we try to make the theme with them and try to innovate what are the ideas they need. And that's very, myself tried it. I put it in my social media, greeting all the nurses on International Nurses Day while presenting and Nursing Now Challenge Now. So another AI is presenting the celebration somewhere else. So I think it's the time to understand, and also it will make the less stress for our older nurses who think that AI can replace, but in reality, no. We are trying to shift them back to the patient side, to the community side, closer, being away all of the unnecessary things that we are doing at running and jumping unnecessarily, I think, or not. I mean, because of the support that we need, we can have a genetic AI assistant nurse, and that's important area that we would like to highlight, in doing a lot of jobs. Yeah.
I mean, who would have
I hope
thought?
I answered your question, but it's an open area and people can innovate, of course, and many things can come. The different type of AI, so I have to study and teach myself also for all of those things. Yeah.
Thank you very much. I think that was eloquently captured, but I think who would have thought a few years ago that we'd be talking about AI and integration in healthcare? We are already here, so I think it's about time. I think the report that you presented, Dr. Carey, has got a lot of attention, and I just want to go back to this kind of data visualization and lived experience reality as well. One question was, how can advanced practice role be scaled effectively without becoming a missed opportunity, as you highlighted in the report? And linked to that, there is a question from Andreas, who's our regional hub lead, about the diversity on nursing education programs across WHO regions. You can see regions where more than 5 years of education has been placed for nurses, and other regions where that period of time is kind of less. The question in place is, have these regions kind of listed advanced practitioner roles and PhDs as part of this data that you presented, or the case is otherwise? Perhaps we're trying to understand how we can make sense of the diversity of these different inputs.
Yes, thank you. That is an important issue around the world in terms of the nursing education quality. It relates to a few different things. So I'll talk about that and then progress to the area of advanced practice in nursing education. We do know that there's a wide diversity in terms of what levels nurses are educated to and what types of nurses are employed in a health system. And honestly, there's such specific country contexts, and the way that they have the whole mix of health professionals is really important. The ultimate goal is obviously the health of the populations, and there could be endless combinations of what types of health professionals, as long as they're working in interdisciplinary, oriented to primary health care and integrated people-centered health services delivery, that can be made up of any number of health professionals. We obviously feel that nurses working to the full scope of their updated regulations and to their education, those regulations reflecting their education and training, is a really large resource. And we think that nurses in those settings should be able to work to that full scope, whether they're an associate professional nurse or a professional nurse, as the International Standard Classification of Occupations from the ILO, International Labor Organization, distinguishes them. So for that reason, that the countries have different approaches to providing those best health services, and the fact that we want every health professional working to the top of their scope, that means the combinations are really different depending on what combination of health provider is there and what is the health setting. So we really work with whatever mix of health professionals, which could be at the same time professional nurses and associate professional nurses with different scopes in different settings with different roles, just making sure the regulations for those are updated and the education of whichever level is the strongest education approach and with the quality standards in place that we're looking for. And with that in mind, we do think about advanced practice and the education of advanced practice and the scope of practice that advanced practice nurses can do. And we know that in terms of not missing in that opportunity, it relates to having those policies and investments in nursing regulation, nursing education, working with the rest of the health system and health services planners so that they understand how to utilize advanced practice nurses. There's an aspect, there's 2 pages of detail in terms of how countries can advance advanced practice nurses, because while in the State of the World's Nursing Report, we found a relationship in the last 2 State of the World's Nursing Reports, we found a relationship between density of medical doctors, so access to medical doctors, and the country use of advanced practice nurses. And that was an inverse relationship. So when we didn't have it, the availability of doctors, countries were utilizing advanced practice nurses more. So we know that they are an effective response for improving access. And we know from the evidence that they also improve health outcomes and cost effectiveness. But in terms of how they utilize those, it has to be all those other aspects of the regulation, the education, and the health services planning. They all go hand in hand. So I think it's always encouraging when leaders like Dr. Sumaya talk about how they are harnessing advanced practice nurses in the context of all the other aspects that they're working on with the digital and the education and the career progression and the leadership and how all those aspects come together. So I do think potentially in the State of the World's Nursing Report, the education data might have reflected some advanced programs for nurses. I think the 5-year programs do incorporate, for example, master's programs. Some of that is whether or not what the entry level nursing program looks like. But also I think it could also be honestly an artifact of that indicator, which it has to be really diversified for reporting on nursing education, because within a country, we can't just say, what's the duration of nursing programs? It has to be for associate professionals. What's the duration? For professional nurses, what's the duration? And there can be a lot of variety in that. And that's why that country level, that specific country profile that we created for the State of the World's Nursing Report that gives that education data at the individual country level is really important to be able to use and dissect and dive into the data a little more. Because sometimes when you see it on the aggregate, you need to really have that more granular level as well.
It's always, I think, the details that just bring the sights to your understanding of what's going on. But that
Right.
was absolutely very eloquently answered. And I've got a question for the 3 of you. I wanted to share, but I think Zebra here phrased the question way better than I did initially. So for the early career nurses, the data and the conversation and how the State of the World Nursing Report is being put in practice can feel very high level, something for governments, for leaders, and institutions. How do you see early career nurses who are with us today engaging effectively in the conversation, as well as early career midwives? Maybe we start with you, Gemma, and then move to Dr. Sumaya and Dr. Carey.
Well, I'll take this opportunity to announce a really exciting development funded by the Burdett for Trust for Nursing, and that's around formalising the collaboration between Nursing Now Challenge and the World Health Organization and the implementation of the State of the World's Nursing Report recommendations. And that support is going to enable us to work really closely with Dr. Carey around equipping our community with the skills and the confidence to engage with this data and to combine that with their lived experience, and so they can understand this whole kind of language of political influence, but also to create opportunities for members of the Nursing Now community to be in person and engage with the in-country dialogue events that the WHO will be hosting across the world over the next year. So there's a direct opportunity for those of you that are current members, but also those of you that are interested in joining Nursing Now Challenge to have that direct influence. And I think probably just on a day-to-day basis, really, there's something really important about us understanding what our early career workforce wants from their profession in order to harness all of their commitment and passion for a long career in nursing. What does that pathway look like? What are the different routes they can take to develop and advance throughout their career? And making sure that that's not by accident, that we work with our policymakers to define those career pathways and create those opportunities.
Thank you very much. Dr. Sumaya, you'd like to contribute?
I think what early career nurses should ask their governments and institution to do differently is they have to understand the pay scale, and they have to create the real career pathways, and they need to also invest in education and jobs equity. Now, I can tell them also shortly, in short answer, that they are the majority of the workforce. So they need to use the power to demand investment now, while there is still time to meet the 2030 goals. What we see in those young generation, if we as leaders do not educate them about those reports and do not engage them with those reports and do not make them understand the number and the facts, they are just busy with their daily routine. So they never think about their career path, their progression, their education, and even how they are going to be the role model for the student nurses. So it's, I think, important, yes, engaging them and making them to understand those reports and see how they can use them to speak the language of data, to speak the language of the state of world nursing report. And instead of just saying, oh, my shifts, oh, my work environment, oh, my unit manager did not, oh, my directors were not supportive. So all of these things will give them the science and give them additional knowledge in terms of personality, their leadership skills. I think all of these are very important to invest in. And they are, the pyramid of jobs, education, leadership are really important to think about and invest themselves.
That is very interesting, I think. And also it's always put the power back into the hands of the nurses and dedicated nurses, because they've always had it. Thank you very much, Dr. Sumaya. Dr. Carey, if you'd like to follow up on those two amazingly articulated points, and what could the nurses, delegate nurses and midwives take today with them?
Somehow I muted myself. Thank you. What I love about this panel is that we have the different representation with WHO and our role, a partner like Nursing Now Challenge, and then a leader like Dr. Sumaya, because it's what it takes is this type of combination from, for example, from WHO. We, our role is gathering the evidence and setting the policy direction. And in the area of nursing development, like next generation early career nurse development, we did see the evidence, we did set the policy direction. The World Health Assembly and all of the ministers together agreeing on that policy direction and the strategic directions of developing the next generation at the country level, like country level investment in leadership development. So we're able to put that out there and have the World Health Assembly and ministers make that part of the mandate for strengthening nursing, is strengthening early career nurses and developing nursing leadership in the younger generation. So I think we have that behind us, and it's a matter of how each of the different partners take that forward. Member states take that forward in their own way, which we heard from Dr. Sumaya, which we heard from Dr. Deepika, from Dr. Jordan in the Caribbean, and Dr. Moya in Mexico. Each of them have done that in their own ways. I've been able to be a part of those discussions in that Dr. Jordan described in the the Caribbean, with 17 countries represented, and talking about how their data indicates what they're doing in each of these areas, including in leadership development. And the same thing in Mexico, where they had 36 states together to discuss how they're using their data, identifying their priorities. And again, there were student nurses in that, really active in that national level policy dialogue, and there were early career nurses involved in that policy dialogue. The same with a number of ones I've attended, including in the Central Asia republics, and where Nursing Now Challenge led a panel and talking about how this new strategic directions for Central Asia, 5 countries in Central Asia, can strengthen leadership development and that role and that voice of early career nurses, and helping countries navigate what are going to be the key actions and investments that will strengthen nursing. So those perspectives incorporated now in these discussions and in the development of national strategic plans, which is what's happening in the Caribbean, what's happening in Mexico, which they're working on in so many states with this evidence from the State of the World's Nursing Report. Having that early career nursing perspective in that dialogue and reflected in those national plannings is what's going to make a different future. And it's important to have the nurses who are going to be leading the country in the future part of those discussions. That's why we're so excited and really heartened by the support from the Burdett Trust to work closely with Nursing Now Challenge for the next year on making sure that voice of early career nurses and that voice of student nurses is incorporated in those policy dialogues and incorporated in those discussions of what are the next steps, what are the investments and policy actions needed to strengthen nursing. We need those future generations in those discussions. So we're really looking forward to that work, and of course continuing to work closely with leaders like Dr. Sumaya and the other speakers on the call today. So thank you very much again for hosting us in this important dialogue.
Thank you very much, and thank you, Dr. Sumaya and Prof. Gemma, for answering all of these questions. And thank you for everyone who've shared their thoughts and their questions and engaged with the conversation in the chat box. Now I'll hand over to you, Gemma, to take the next steps.
Thank you, Hassan, and really huge thank you to you for coordinating those questions. There were so many wonderful questions in the Q&A, and we will do our utmost to respond to those either today or later on after the event. We're going to take a short break now, just for 15 minutes, to give you opportunity to move away from the screen, or also to go and visit our booths, where you'll find our partners are there to chat with you about their organisations. We will reconvene at 11:30, and that's where we will be hearing from David Stewart from the International Council of Nursing on their new campaign around empowered nurses saving lives. Thank you all.